I am Dentist Fortune. Today I'm going to be sharing some gems with you. So please stay till the end. I'm going to be talking about World Health Day. Do you know the 7th of April, which is celebrated by the World Health Organization all over the world, is World Health Day. And I'm going to be focusing on oral cancer. My topic is how cancer screening saves lives. The learning outcomes. What is World Health Day? Importance of oral cancer screening and doing it yourself. Yes, I'm going to teach you how to screen for oral cancer yourself. So please stay for all the tips. So one may ask, what is World Health Day? It is a day used to raise global awareness about important health issues all over the world. And this was instituted by the World Health Organization. And the theme for 2026 is Together for Health, Stand with Science. It covers collaboration among content creators and health people all over the world. It is also the anniversary of the founding of World Health Organization since 1948, and this is a global health awareness. So, why is oral cancer screening important? I've always been passionate about prevention is better than cure. And if a patient comes in, we always take their history. And one of the questions we do ask is, do you smoke and do you drink? Do you know that if you smoke and drink, your oral cancer risk is high? And also, some people chew tobacco or some people chew betel nuts. So, all those are risk factors for oral cancer. Do you also know that according to the World Health Organization, oral cancer, which affects the lips, the oral mucosa, the floor of the tongue, and the mouth. According to the World Health Organization and GlobalCon 2022, oral cancer has been ranked as one of the 13 most common cancer in the world. And do you also know, according to the World Health Organization, it is estimated that there are 389,846 cases every year. So one may be asked, if it's oral cancer, how would I know? Well, in order to be diagnosed, you need to see a medical professional. There's a difference between screening and there's a difference between having a proper diagnosis. So screening is what I'm going to go with you through with you. But in order to have a diagnosis, you need to see a clinician, a specialist for biopsy, and they will have to carry out a series of tests. They will need to look at your medical history and things like that. So whatever is said, you still need to see a clinician face to face. This is virtual. I'm only going to be showing you about screening. Always remember there's a difference between screening and diagnosis. So, this is a DIY, do it yourself oral cancer screening. Yes, you can do it yourself, and I'm going to show you how to do it. So, the first thing to do is you need to wash your hands. You need a bright light. You can use a ring light or a very bright light. And you need a big mirror. You know yourself, you are with yourself 24 hours. So if there's anything unusual, you'll be able to. So what you'll be looking out for is changes in color, texture, any lumps, any unusual lumps, any asymmetry. If you look at your face, you need to examine your face. Do you see anything different? Do you see any swelling? Do you think one side of your face is bigger than the other? Turn your head to the side and stretch and then feel the side of your neck. Do you feel any lump, anything unusual, any tenderness? Now, look at your lips. Feel your lips. Do you feel any tenderness? Do you see any ulcer? If you have an ulcer in your mouth that has been there for more than 2 weeks, please seek medical attention. Yes, once in a while, you do have ulcers, especially if you are run down and you are stressed. You get some form of ulcer called aphthous ulcer. Those ulcers clear up by themselves within 2 weeks. Or if you are run down, or some people, if they're anemic and things like that, or there could be underlying health issues. But if you have an ulcer that is not healing and is there for more than 2 weeks, please seek medical attention. Feel your lips. Do you feel any ulcer? Do you feel any unusual lump? Any change in color or tenderness? If you have a mole on your lip, at times you see a mole. Some moles are like a birthmark. That is fine. But if you find a mole on your lip and every time you see it is getting bigger and bigger, please seek medical attention. Look at your upper lip, move it outwards. Do you feel any tenderness, any ulcer? Okay. Now the next stage is stick your tongue out. Look at your tongue. Do you see any ulcer or any lump? Turn it to the side. Do you see any ulcer on the side of your tongue? Lift your tongue up. Look at the floor of your mouth. Do you see any ulcer? Look at the roof of your mouth. Any texture, any tenderness, any color. So you need to feel for that. Look at your gums. Any ulceration in your gums. So these are things that you can do yourself. And if you find anything unusual, any unusual lumps, any ulcers, any white or red patches in your mouth, please seek medical attention. As always, I always give dental tips. Brush twice a day with preferably a fluoride toothpaste. Spit after brushing. Limit sweet to meal times. Visit the dentist regularly. If you have an ulcer which does not heal greater than 2 weeks, please seek medical help and change your lifestyle because, as I said earlier, we normally take a history, and normally, if someone smokes and drinks, their risk is higher. And as always, prevention is better than cure. As always, there's always a disclaimer. The information provided on this YouTube channel is for general information purposes. Why we emphasize that dental prevention is better than cure, any content shared on this channel should not be considered as a diagnosis or treatment. This is virtual. You need to see someone face to face who needs to take a history, carry out some tests, if possible, take a biopsy before coming out with a diagnosis. Thank you for staying till the end. Thank you and see you in the next video. Thank